Hi, this is Angel from Basic Science 3B. In this video, I'm gonna going through Wilson disease. Wilson disease is a rare genetic disorder in which there is copper poisoning in the body. It is also known as hepatolenticular degeneration and progressive lenticular degeneration. Copper is essential in developing healthy bones, nerves, collagen, and melanin. Copper from food is absorbed by the body and excess is secreted out from the body through the liver. However, in people with this disease, the liver is not able to eliminate the excess copper, and those copper builds up in the brain, liver, eyes, and other vital organs. If not diagnosed early, Wilson's disease could become life-threatening. It usually affects people in the age group from 5 to 35 years old but could not affect younger or older people too. So what are the symptoms of Wilson disease? Basically, Wilson disease is present at birth, but signs and symptoms don't appear until the copper builds up in brain, liver, or other organs. Signs and symptoms vary depending on the parts of your body affected by this disease. They can include fatigue, lack of appetite or abdominal pain, a yellowing skin and whites of the eye, golden brown eye discoloration, filled buildup in the legs or abdomen, problems with speech, swallowing or physical coordination, and uncontrolled movements or muscle stiffness. How do people diagnose? Wilson disease may be difficult for doctors to initially diagnose. The symptoms are similar to other health issues like heavy metal poisoning, hepatitis C, and cerebral palsy. Sometimes, your doctor will be able to rule out Wilson disease once neurological symptoms occur and there is no KF ring visible. But this is not always the case for people with liver-specific symptoms or no other symptoms. A doctor will ask about your symptom and ask your family medical history, and they'll also use a variety of tests to look for the damage caused by a copper accumulations. Physical exam. During your physical exam, your doctor will examine your body, listen for sounds in the abdomen, check your eyes under the bright for KF rings or sunflower cataracts, and test your motor and memory skills. Lab test. For blood test, your doctor will draw samples and have them analyzed at a lab to check for abnormalities in your liver enzymes, copper levels in the blood, lower levels of ceruloplasmin, a protein that carries copper through the blood, a mutated gene, which is also called as genetic testing, and low blood sugar. Your doctor may also ask to collect your urine for 24 hours to look for copper accumulation. Test. Magnetic resonance imaging or MRI and computerized tomography, CT scans, may help show any brain abnormalities, especially if you have neurological symptoms. These findings can't diagnose the condition, but they can help determine a diagnosis or how advanced the condition is. Your doctor will look for weak brain stem, signals, and damage to the brain and liver. Liver biopsy. Your doctor may suggest a liver biopsy to look for signs of damage and high levels of copper. If you agree to this procedure, you may need to stop taking certain medications and fast for 8 hours beforehand. If your doctor finds the presence of Wilson disease, they may recommend you and your sibling to take genetic tests too. It can help identify whether you or your other family members are at risk for passing on Wilson disease. You may also want to consider future screening for your newborn if you are pregnant and have Wilson disease. Now you might wonder how this disease can be inherited. Wilson disease is inherited as an autosomal recessive trait, which means that to develop the disease, you must inherit one copy of defective gene from each parent. If you have received only one abnormal gene, you won't become ill a carrier and can pass the gene to your children. How is Wilson disease can be treated? A healthcare provider will treat Wilson disease with lifelong effort to reduce and control the amount of copper in the body. Treatment may include changes in eating, diet, and nutrition, a liver transplant, medications such as chelating agents, which are medications that remove extra copper from the body by releasing it from organs into the bloodstream. Once the copper is in the bloodstream, the kidneys then filter the copper and pass into the urine. A healthcare provider usually recommends chelating agents at the beginning of treatment. A potential side effects of chelating agent is that nervous system symptoms may become worse during treatment. Example of these treatments are tretinoin, and D-penicillamine. Wilson disease is an inherited gene that is passed down from parents to their children. If parents have child with Wilson disease, they could potentially have other children with the condition as well. Although you can prevent Wilson disease, you can delay or slow down onset the condition. If you find out you have Wilson disease early on, you may be able to prevent the symptom from showing by taking medications like zinc. A genetic specialist can help parents determine their potential risk for passing Wilson disease to their children. I hope that you gain knowledge on my video. Thanks for watching!